Hi, this is Dr. Scott Brunengraber from Smithtown Wellness. And the purpose of this video is to introduce to you the idea of chiropractic for the pregnant patient. The pregnant patient is different from every other patient in the sense that they are caring for another being within them. So that sets up a whole different set of circumstances on why their body is experiencing what they're going through, and does add some complications to the average person. Obviously, the body is going through major changes. The baby's developing in the womb. Obviously, it's getting bigger over time, which throws your center of gravity off. Muscles start to change because they have to compensate for this weight that's now in front of you. And it can get quite painful because your body is not used to this new set of parameters, this new condition. And even if you've been pregnant before, it's still, the body has some memory, obviously, to what you went through, but it has to go through it again. And it was used to being not pregnant for a little while, and now you're asking it to go through major changes in a short span of time. 9 months is not a long time. So in chiropractic, our focus for the pregnant patient, or any other patient for that matter, is this patient's nervous system functioning at 100% of its potential? This communication system, the brain, spinal cord, and all the related nerves, is it working at 100%, or is there something interfering with it? Because if something is interfering with it, the body is now going to exhibit less than 100% health. We all know the body can heal itself. Chiropractic works with the innate healing ability of the body. And if there is nerve interference, that innate healing ability has been handicapped. So with the pregnant patient, you want as much of that healing capacity and that ability of that nervous system to maintain control and coordination amongst all the systems, including the reproductive system, to the best of its capacity, so that your child can develop to its potential. So I'm going to just introduce just a model of a spine. So up here would be the brain, spinal cord, and down here the lower lumbars and the pelvis. If you look this way, this is the birth canal. So the pelvis makes this shape up. So if you can imagine, if the pelvis were to shift, this starts to change the shape of the birth canal. So maybe some of you who are watching this video have been pregnant before and noticed that it was quite difficult to get the baby out. There was maybe you had a C-section. They said that the labor had stalled. Maybe you had a friend who said, wow, no matter how much she pushed, the baby didn't want to come out. That is called intrauterine constraint. Within inside the uterus, there's constraint. There are all muscle attachments here. There are tendons going across this way. You have tissue everywhere. And if the pelvis shifts its alignment and the low back shifts its alignment, now these muscles start to get abnormally activated on one side of the body, causing tightness, and the opposite happens on the other side of the body. So now, not only could it be painful and maybe not allow for the baby to come out in a nice, easy way, but it also could prevent the baby from going vertex, which is head down. And maybe the baby is breech or transverse, where the baby is across the pelvis. So chiropractic seeks to bring balance not just to the nervous system, as I mentioned before, but bring balance to the musculoskeletal system that is caring for your unborn child. We do this through very gentle adjustments to the pelvis and the spine. And it is done sometimes with our hands, but most often a tool such as this, which is tipped in very soft rubber, just emits a light tap. And that light tap is enough for us to deliver chiropractically an adjustment to your nervous system and bring balance back to your musculoskeletal system, the pelvis, the spine, and all the musculature as well. I hope this video shed some light on how chiropractic can positively impact your pregnancy. and enable you to have the safest, healthiest, happiest birth you can imagine. So please don't delay. Contact a chiropractor and see how you can experience 100% health today. This is Dr. Scott Brunengraber. Please live and be well.